Hello, I am Roula Alameddine Doughan, and I'm the Operations Manager at the Lebanese Center for Palliative Care, Balsam in Lebanon. And I would like to thank you for having me today and to be able to introduce our NGO better and to explain about our mission and the things that we do. So Balsam is an NGO, it's a non-governmental organization. It was founded in 2010 and it was registered at the Ministry of Interior in March 2011. It started with 3 people. There was the founder, who is a doctor, a palliative care physician, along with 2 nurses who had interest in the field of palliative care. During the first year, they took care of 4 or 5 patients. Today, 10 years later, we are a team of 14 people. We are a multidisciplinary team that includes physicians, social workers, psychologists, nurses, and dietitian and pharmacists. This team cooperates and works together in order to provide palliative care and to work in the fields of advocacy, capacity building, and research. These are the 4 main components of our mission. To this day, in 2020, for example, we provided palliative care support to more than 200 patients. And since 2010, we have helped more than 1,200 families. So we have grown quite a bit since the day we started. Okay, so when we started in 2010, the concept of palliative care was not a familiar one. We had the duty, we believed that every person, every sick patient, or every sick human being had the right to receive palliative care and to be as comfortable as possible. So we started introducing the concept of palliative care not only to our patients and their families, but also to the community, to the Lebanese community. And this has shown also in our numbers. So if we look back at the numbers, we had referrals coming from 2 or 3 physicians during the first year, while now we have referrals coming from physicians all over Lebanon, and in fact, sometimes from different countries. So the concept of palliative care has evolved. And for that, we have played a major role. The concept, the specialty of palliative care is a recognized specialty now in the Ministry of Health. We have conducted a lot of capacity training. So we have conducted courses to nurses and physicians working in the different hospitals to teach them about the basics of palliative care. Our team member provided that training, and we had trainers from different sides of the world. So we have worked into these areas. We have published a lot of research and paper on the fields of palliative care as well. That goes in the component of the research of our mission. And we were working on a study to show how the receiving palliative care, in fact, minimizes the cost, and it would be it would help if the insurances adopted palliative care and covered the fields of palliative care instead of just leaving it as a matter that is not recognized by the insurance companies. So we have had several projects ongoing in the past years. Well, when we started, we were the only NGO along with another NGO providing palliative care to the community. Now with time, we have different hospitals who have palliative care services within the hospital. For example, at the UBMC, at the American University of Beirut, there is a very big palliative care service, and a lot of people who work at Balsam work at the UB as well. So the palliative care service is becoming more and more common. People are accepting it more, and the common misconceptions are becoming less and less. For example, the concept of palliative care that is provided only end of life is being corrected, because early palliative care is also needed and can help the patient and the patient's family tremendously. So we have seen changes and progress in the community and in the hospitals over the past 10 years, yes. So the mission of Balsam is, as I told you, it aims to relieve the suffering and improve the quality of life of people facing life-threatening disease through patient care, capacity building, advocacy, and research. Balsam is committed to developing palliative care in Lebanon and to ensure its integration into the healthcare system. The vision, we aim to make palliative care available to everyone. You know, our resources are still limited. We are an NGO, which means that we do not charge for our services. We believe that every patient is entitled to that right. So we provide the palliative care services regardless of the background, the economic status, the sex, the religion, the affiliation. Every patient who calls and who needs palliative care will receive it from our organization. Our resources are still limited because we don't have funding and we're not sustainable yet. Yet, we believe we work in order to make it as available as much as possible. And this is where I told you we were trying to work with the insurance companies and with the Lebanese government, with the Ministry of Health, to make it as available as possible and to make it covered by the ministry, the fees of the palliative care covered by the Ministry of Health or by the insurance. You know, the services we provide are not, they're free, not because they're not expensive. It takes a lot of resources to train our staff, to mobilize them, to make them to have them available for the patients whenever they're calling them. So it is an expensive service. Yet we're managing to provide it from private funding, from the donations that we get from the supporters of our mission. But we still have limited resources. We have sometimes long waiting lists of patients we cannot manage to help at the same time. So we are working to make ourselves sustainable and to make that service available to everyone. So our team is formed of physicians. We have 2 physicians on the team. We have, in fact, it is, if I want to tell it, make it clearer to you, we have 2 sections, 2 divisions of the team. There is the administrative part and there is the medical part. The administrative part, which includes the operations manager and the quality control coordinator, who is the assistant at the same time, and the medical team, who is headed by the medical director. And along that section, there are the physicians who ensure the coverage of the patients. So every week we have 1 physician on call. So the nurse who is providing the palliative care service to the patient can go back to the physician for any questions or quests she has. So we have the physicians, we have the pharmacist, we have the dietitian, and we have the nurses. We have 2 full-time nurses and 4 part-time nurses. All this team works together in order to agree on the plan of care of patients and to follow up on the patients. The nurses visit their patients in their home setting, so they pay home visits, and they assist the patient and the family of the patient in this difficult time of their life. They go, of course, the team meets on a weekly basis to agree on the plan of care. And as I told you, the physician, there is always a physician on call to help the patients. The patients are available 24 hours a day, 7 days a week to assist the patients, and they go back to the physician on call whenever needed. We have as well a psychologist and a social worker who covered the psychosocial aspect of the patient and their families as well. So it's nurses, physician, psychologist, social worker, dietitian, pharmacist, and the administrative team. So this team, as I told you, are all mostly part-timers. The only full-timers are the 2 full-time nurses that have been with Balsam for the past 6 or 7 years. The rest of the team members, other than the administrative, in fact, I'm talking about the medical part who provides patient care, are part-timers. They meet, as I told you, on a weekly basis. That's what we call the IDT, the interdisciplinary team meeting. They meet to discuss the new referrals, the new admissions, and the plan of care of the other patients. The medical director is always available to coordinate. And we do general administrative meeting on a monthly basis where we discuss new projects, new cooperation, or any team concerns. And we use also this monthly administrative team meeting for capacity building purposes in case we have a training. The medical team, as I said, they meet on a weekly basis for follow-up. Most of the times lately we have been having speakers, guest speakers, international guest speakers who are knowledgeable, known figures in the field of palliative care, who assist to these meetings, and they help us in the plan of care. They give in their input, they give in their, they share their experiences in order to provide the best care possible to the patients. Okay. So what has happened is that because of the reputation we built and the service we have provided during the past years in the community, the physicians know more and more about us. They have accepted the concept of palliative care and they trust us with their patients. So what happens is that they ask their patients whenever they think that they are in a stage where they would benefit from palliative care to call us. Sometimes the patient, they hear out of word of mouth or a family member refers them. So it doesn't have to go through their primary physician. But most of the times it is through their primary physician or through the palliative care team that is available in some hospitals. So the patient calls us upon the request of the primary physician and we take their basic information. After we take their basic information, the patient is assigned to one of the nurses who pays him a visit, does the assessment, and devises the plan of care. Of course, she goes back in her plan of care to the team that will meet on a weekly basis, like I told you. The primary physician, upon the approval of the patient, sometimes the patient would like to keep the physician in the scope, sometimes they decide not to. If they would like to keep the physician in the loop, the primary physician is provided with a weekly report updating them on the status of their patients in order to have the care coordinated with them. So we do inform them of all our decisions and our changes and the updates on the patient's status. As I told you, over the years, we have seen a tremendous increase in the number of physicians referring patients to Balsam. So I don't have the exact numbers in front of me. I can share them with you later on. But we've had like around 7 or 8 physicians referring the first year. Now we have more than 40 or 50 physicians. In order to answer that question, I would like to explain to you before one aspect of the care that Balsam provides. So as I told you, since our resources are limited, we are only able to provide this service to the people living inside the greater Beirut area. To the people living in the areas in Bekaa, in the south, in the north, we cannot go and pay them visits because we don't have the resources for that. We have established something we have called the distance support program. The distance support program is providing the same palliative care, but it's also only through phone. And you know now with COVID and the challenges, telehealth has become more and more acceptable. We had started that program even before COVID, and it helped us survive COVID because we shifted all our patients to distance support because we were not paying them visits. So the people living in the areas, not inside Greater Beirut, we provide them with distance support, which is, as I told you, telephone, video support. The nurse is available on the phone to help them 24/7. And of course, the plan of care is divided in coordination with the team. I would like to see Balsam spread all over Lebanon, where we would have units in the different areas to be able to pay visits. The patients usually who receive the distance support care are very grateful. They have benefited from the service we have provided. But you know, the human contact is always different. So I would like to see Balsam growing in order to have Balsam spread all over the Lebanese territory, maybe outside Lebanon even. And I would like to see our team growing in order not to have waiting lists. Unfortunately, a lot of time, especially with the crisis now happening in Lebanon and people being able to afford less and less the medical care, people are asking for home care. People are asking for us to go and help them at home because they cannot afford the hospitals anymore. And for that, we are having waiting lists a lot of time. And sometimes our patients pass away before we even get the chance to send them someone to help them because we are a limited team with limited capabilities. I would like to see us growing. On that, we're trying to make ourselves sustainable because that's the only way to grow. We're trying to reach out for capacity building opportunities to make these as a source of funding for us. We rely a lot on the donations we receive from the people who believe in our mission, but we still have a lot to do in that field. Of course, they can reach out to us. We welcome any kind of cooperation, whether it is research, capacity building, or advocacy. We can cooperate, and we have a lot of third-party cooperations that both parties have benefited from. So the way to reach out to us is to email us on our email info@balsam-lb.org. It would be great, and then we can take it from there. Or they can reach out to me. It's r.doughan@balsam-lb.org, and we can of course coordinate and see how we can take that initiative further. Well, I don't have advice as much as I have our story to tell. So when the initiative started in 2010, I told you the first year, the number of patients was barely above 10. And there were 3 people on the team. Today, 10 years later, despite, that the situation in Lebanon has not been stable, there have been a lot of ups and downs, but there have been believers who supported us all through. And we were able to offer care for more than 1,000 families. I think that alone is the advice for anyone who thinks that they can support their community, that there is no obstacle that they cannot overcome when they have the will to help. I believe with Balsam that always the good things happen, and whenever we reach like a dead end, something opens from another side. The team has grown. A lot of people have left. A lot of new people have joined, but the mission is still there, and there is still a commitment to help the community. We always tend to say to our team that once a Balsamer, always a Balsamer. It's a cause that we all carry at heart, and we are committed to helping our community. And it's only when you hear the feedback from the patients' families, and you hear how committed they are to helping us, even years after their patient passes away. We have still families who come and visit us on the bereavement memorial of their loved ones, and they say that without our help, they couldn't have overcome that difficult period. And it is this kind of feedback that gives us all the motivation to continue providing the service. So whenever there is a way to help our community, I think everyone should jump in, and then everything will become easier after that.